whatever you do, if you go out or come home, wash your hands frequently. That's the most important message. Secondly, avoid going to crowded places. I understand that on Sunday, sometimes it's holiday for everyone. You notice that we like to meet friends and relatives and gather. So it applies to everyone in Hong Kong. That now we discourage people to have sort of a mass gathering. You notice that the Hong Kong government and a lot of business association, they cancel all the celebratory dinners, lunch, whatever. Chinese New Year, we normally have a lot of big family meals. We now try to discourage or ask people, not to have this mass gathering. So this is what we want to minimize the contact. And why we have to do this is because you've seen from the news, every day there may be 1,000 or 2,000 new cases. So we are still observing the trend, what we call is the epidemic trend of this disease. We are not still seeing the peak of it. What we understand is similar to SARS or MERS. This virus generally does not withstand heat of 30 degrees. So we need to buy some time. Once the weather gets warmer, then the transmission will be less favorable. So the next month or two is very crucial because one, this is the start of outbreak. We don't know when the peak comes. So it's a new virus. That's why we're treating it seriously. If you have your memory, back in 2009, for swine flu, we took similar actions. But then after a month or two, we realized the behavior of the virus, it was less severe. There was less mortality. But this one, what we're seeing, at the moment, the mortality from the official figures may be around 3%, but there's still a lot of serious cases. For SARS, it may be up to 10%, and that's a lot of fatality and morbidity for a virus. So that's why in this stage, we hope that you would support the government. And again, remember your hygiene, wear masks, and also there are policies of going to China or other places with outbreak. If you come back from mainland China, the government will ask you to try to stay at home for self-quarantine for up to 14 days. That means that you should minimize social contact. And if you have to go out, then you need to wear a mask. If you have symptoms, if you have fever or anything, then go to see your doctor or go to a public hospital. If you come back from Hubei province, then they have to be identified, report to our health division, and will be sent to what we call quarantine center. So this quarantine center are for people who may be close contacts of a case, or those who have come back from Hubei province that are high risk. They are not unwell, but we want to make sure. So they need to stay there for 14 days. So we are also, if you come back now, you notice that at the borders, we are increasing the temperature check, and also for the, we are doing more what we call health declaration. So we're asking you where you come from. You need to fill a form in to tell us what your symptoms are, and whether you had fever, where you visited, etc. So this is to try to stop a case coming in. Now, at the moment, we have 14 cases in Hong Kong. Some they all associated with Hubei. Maybe one is we don't know yet, maybe local. But the main thing is we don't want a local outbreak to occur. So we might have every now and then what we call this imported case, or case that has a link to Wuhan or Hubei province. But we don't want that we have a sustained transmission in Hong Kong. So that's why we need your help. So in order to get your help, then we need to explain to you what are the things you need to look out to. So we try to encourage you to, for the time being, try not to go to crowded places. Try not to have mass gathering. It applies to everyone in Hong Kong, okay? So we then like to deliver a talk to you first, and we leave you some time after the talk. You can ask any question about health talk or anything I've said just now. I will clarify again. So I'll pass my mic to Ms. Lee. Ms. Lee will take you through the health talk, and then after the health talk, then we'll come back and you can have plenty of time to ask questions. Okay? Thank you.
Thank you, Dr. Ho. Thank you, Consul. Good morning, I'm Tracy Lee from the Department of Health Promotion Branch. Today I represent the prevention of severe respiratory disease associated with a novel infectious agent. The disease refers to the cluster of viral pneumonia cases occurring in Wuhan, Hubei province since December 2019. According to investigations by the health authorities in mainland, the causative agent is a novel coronavirus. This picture showing the latest situation as of 1st of February, 9 a.m. There are up to now 14 cases in Hong Kong, 1 case in Philippines, and there are 11,791 cases in China, caused 259 deaths. On the 30th of January, the World Health Organization, WHO, declared the outbreak of the novel coronavirus a public health emergency of international concern. Now we discuss the disease. Symptoms of the cases present with fever, malaise, dry cough, shortness of breath, and those will turn to serious condition, especially for those with underlying disease and older age. The main mode of the transmission of the disease is respiratory droplets and contact. The incubation period ranges from 2 to 10 days and may be as long as 14 days. The main treatment now is supportive. At this moment, there is no vaccine for the disease. To prevent the infection, maintain a good personal hygiene is very important, and always keep our hands clean. We wash our hands before touching mouth, nose, and eyes, after touching the public installations such as handrails, doorknobs, and after coughing and sneezing. And now I will show a video about how to wash our hands with a liquid soap and water. Page 12. Please watch the video together. Actually, I have a PowerPoint slide showing how to wash the hands, and also you can search from the CHP YouTube channel. So we back to the slide 11 first.
outside of that lane at that time. I play games with the flu. I play games with 102-degree fever, man. This obstacle could not define me. It's not going to cripple me. It's not going to be responsible for me stepping away from the game that I love. I'm going to step away on my own terms. Because when I retire, I didn't want to have to say, I wish I would have done more. I would watch Magic play, I'd watch Michael play, and I would see them do these unbelievable things.
Yes, this picture showing the 7 steps hand hygiene technique. First, we wash our palm.
He'd be the first to tell you that.
And then the back of the hands. This is the area we frequently miss. And then the finger webs between the fingers. And then we rub with the hands interlocked together, the finger back. And also we wash our thumb like this. The fingertips we always miss, include the front feet. And also the wrist. If there is a hand washing facilities, turn on the water tap of course, and then we wash our hands with the running water. And then we apply palmful soap, make a soapy lather, and then follow these 7 steps, and rinse thoroughly with the clean water. And after we finish the hand washing technique, how about the water faucet? We use the disposable towel to shut it down. Don't touch again. Okay. And then we dispose the paper towel. It's easy. If the hands are not visibly dirty and there is no hand washing facilities available, we can use alcohol-based hand rub instead. Apply a palmful of the alcohol-based hand rub with 70 to 80% of alcohol. Palmful means 3 to 5 mils. To wet all surfaces of our hand and follow these 7-step techniques and wash our hands at least 20 seconds until our hands are completely dry. Okay. So, and for personal hygiene, we also need to wear surgical masks when we take public transport, the mass transit wearing, the bus, and also when we go to crowd places. And maintain a good cough manner. When we cough, cover with tissue and sneezing. And after the tissue is soiled, we dispose in a little bin and wash our hands immediately. How about if tissue is not available? We can cough into the clothes or with the upper lips like this. Yes. So a face mask is important because it serves as a barrier to respiratory droplets. It can protect ourselves and also prevent infection to others. However, the N95 respirator is not generally recommended for general public because special training for wearing and removal is required. If it is not properly used, the N95 respirator will increase the infection risk by contamination and inadequate protection. And now the surgical mask actually include 3 layers. The outer layer is for water repelling, the middle layer is barrier to the germs, and the inner layer is moisture absorption. And for wearing a mask, we need to choose appropriate size. We are adults, so we need to choose the adult size. And the child, of course, use the child size. And perform the hand hygiene, 7 steps, 20 seconds before you put on the mask. And put on your mask with the metallic strip facing upmost, and then cover your face and fit it on your face snugly, covering all the nose, the mouth, and your chin. After wearing the mask, do not touch the outer layer of the mask. And in case the mask is damaged or dirty, you can change a new one. And never reuse a single-use mask. When you take it off, just touch the earlobe. Do not touch the outer layer because it may be contaminated by the respiratory droplet already. And please dispose the mask in a little rubbish bin and then perform hand hygiene immediately afterwards. Okay. There is a travel advice for Hong Kong. Please, in this period, do not travel to Hubei province, Wuhan. If it is unavoidable or essential to go, please do self-isolate for 14 days after returning to Hong Kong. As if members of the public need to go to other parts of mainland, please stay home as far as possible, at least 14 days. If they need to go out, please wear a surgical mask.
May I stop here? This is already outdated. So if you come back from Hubei, you have to report to the health authority. You will be put in quarantine. So things are moving very fast. So we have increased the containment. And if you come back from mainland, we already asked you to try to stay at home, self-quarantine. And if you have to go out, wear a mask. And we encourage everyone, those who come back from mainland, work from home if you have to go to work, unless, so we have a policy, even for civil servants, that we will give them leave to stay home if you come back from mainland. Sorry, Tracy.
Thank you. So if you travel, do not touch the animal, include live poultry, and please don't eat game meat. Avoid visiting the wet market, include live poultry market or farms. After returning to Hong Kong, if there is presentation of fever or respiratory symptoms, wearing a surgical mask and go to seek medical advice promptly. And review the past travel history. For the environment, especially for the workplace or home, clean and disinfect the furniture and area with the diluted bleach, 1 in 99 diluted bleach. That is 1 part of the household bleach in 99 parts of water. Leave it for 15 to 30 minutes and then rinse with water and dry off. And frequently touch areas such as telephones, doorknobs, please disinfect twice daily. For metallic surface, can use over 70% alcohol to disinfect. When handling vomitus, secretion, use highly absorbent paper towel and dispose it afterwards. Disinfect the area with 1 in 49 diluted bleach. For the toilet and bathroom, please keep dry and clean, and ensure the flushing system is functioning. Make sure the drain and pipes does not leak and are not blocked. Keep water in drainage U-tracks. And every week, pour half a liter of water into the floor drain. And for better ventilation in the indoor area, always turn on the exhaust fan and open the window. For the dust filter, clean frequently. For more details, you can visit the chp.gov.hk, and there is a dedicated webpage which provides relevant information for the disease. You can check the countries with reported cases, the local situation, and information is also available in other languages, including Tagalog. There are health education materials such as poster, pamphlets, infographics, and also video. And I just introduced the video you can find from the CHP YouTube channel, and there is CHP Facebook page. For more information, you may also call the Health Education Info Line 2833-0111. And we have brought some pamphlets in Tagalog here for distribution. And thank you, that's all for my presentation. Thank you.
I want to highlight a very important point is all the latest information you can get from our CHP website. We are actually in the process of making this even better, more information, not just health. So we're working on it. So you find there's already a lot of information there, mainly health related. We're trying to, by next week sometime, hopefully include other information that you need. So in case you want to know the latest about everything about this epidemic, it's a very good resource place to go, www.chp.gov.hk. And for all the epidemic information, you should be able to find it, so stay tuned. And I know a lot of you know how to use your mobile phone, so that's